Hydrocephalus refers to increased fluid within the ventricular system of the brain. Now, the ventricular system of the brain is that part of the brain that actually produces cerebrospinal fluid. And we produce, on average, about half a liter of cerebrospinal fluid, which circulates around the brain as well as the spinal cord, and it is reabsorbed into the venous system. So there's sort of a natural pathway of that flow of spinal fluid. Hydrocephalus typically refers to when that fluid builds up in the brain itself. And that can be secondary to a variety of different causes. Typically, hydrocephalus presents with headache. Headache is the #1 symptom that most patients will present with. Sometimes they will also present with blurry vision because the optic nerves, which control our vision, actually follow the pathway of their cerebrospinal fluid. And if the fluid starts to back up, people can develop difficulties with their vision. Sometimes nausea, sometimes progressive lethargy, and even as far as obtundation. Hydrocephalus can be caused by a variety of different factors. Typically, if we were to group them into two specific groups, we would group them into obstructive hydrocephalus as well as communicating hydrocephalus. So obstructive hydrocephalus refers to something obstructing the natural flow of spinal fluid. And that can be a brain tumor, that can be blood products from an intracerebral hemorrhage, it can be from other causes like inflammation or even an infection. If that flow of spinal fluid is blocked, it tends to build up in the brain and patients can become symptomatic. Communicating hydrocephalus typically means that all of the fluid pathways in the brain that contain spinal fluid appear to be dilated on brain imaging studies, and so that all of the passageways are in communication. However, they tend to be enlarged, and usually the most common reason is that there is an obstruction in the way that the spinal fluid is reabsorbed through the venous system. So that could be secondary to the natural process of aging. And in that, we may talk about normal pressure hydrocephalus. Normal pressure hydrocephalus refers to a patient who has normal pressure within the brain, but the fluid-filled spaces appear to be enlarged, likely because they've lost the ability to reabsorb the spinal fluid. Hydrocephalus typically is diagnosed via MRI imaging of the brain, where we're looking to see the ventricular caliber, or the size of the ventricles themselves, where the spinal fluid is made. And there are certain parameters that we look at on MRI studies to be certain that those ventricular spaces are dilated and how they are dilated as opposed to the regular brain tissue. So MRI is the gold standard.